Thank you for this opportunity. My name is Marissa Goldsmith, and because we have a snow day today, I can introduce you to my daughter, Anna, who's sitting right here with me. Anna is a bright and happy child who enjoys school and is eager to learn. With her physical disability, though, she requires constant care, attention, and close supervision. Both my husband and I work full-time, and when the pandemic began, we were able to work from home. But unlike other families, we simply didn't have an option to put her in another room while we worked, or while she played or attended virtual school. There was always a need for one of us by her side to help her out. And I am self-employed, so luckily I had the flexibility to go down to part-time. But I have no leave or vacation time because I'm self-employed. So when I don't work, I don't earn. And then for the first 3 months of the pandemic, we also decided it was best not to let anyone in the house. So I would care for her during the day while my husband worked. In the afternoon, in the evening, he'd care for her and I'd go downstairs and start working. It was exhausting. And despite the fact that we were in lockdown in the same house, my husband and I rarely saw each other. And so after those 3 months, when we decided it would be safe to have a caregiver enter the house and give us some relief, it took over 3 months for us to find someone. Even when we shifted from consumer directed, looking on care.com to an agency model, there was an extreme shortage of health. Yeah, Ms. Bell helped us out. That's right. There was an extreme shortage of health professionals available, and that shortage persists to this day. We spent nearly 6 months, day and night, as Anna's attendants. While we loved taking care of her as our child, we were also exhausted, and it made it extremely difficult to relate to her as our child instead of our patient. During this time, it was so important to know that we were able to get paid for providing her care. And that is why I urge you to keep this flexibility so that parents can provide health services to their children and get paid for it just the same as a healthcare professional would. Lastly, it is absolutely imperative that we increase the pay rates for in-home providers as outlined in the DD Rescue Plan. As we stare down the barrel of Omicron, it's becoming more likely that we're going to need to remove our vulnerable children from these crowded schools again and return to virtual learning. And my husband and I will be right back where we were in 2020 with no qualified caregivers to give her support. Thank you.